There are many factors outside of healthcare that can affect our health. Income, education, housing, gender, race, disability, employment, working conditions, food insecurity. Every year, Elgin St. Thomas Public Health surveys the price of food items across grocery stores in Elgin St. Thomas. The survey is called the Nutritious Food Basket. In 2015, the monthly cost of groceries for a family of 4 in Elgin St. Thomas is $838. When money is tight, people often have to cut their food budget to afford other basic expenses. They may eat a less healthy diet or skip meals. This is called food insecurity.
When you don't have food, you can't think. When you can't think, you don't become a productive member of society. So you become stuck. You can't function properly. If you're a parent, you can't care for your children properly if you're the one going without in order to feed them. There's all kinds of repercussions to that. It means you're not entering the workforce with a clear head, at a good strength level, at an adequate emotional level to cope with what's going on. If you don't have food, it affects all of those things. Your ability to think, how you feel about things, how you cope with things, how you react to people, how you move forward. It affects everything you do. Food is the building block of everything else. And if we don't have that, we can't build anything else.
Many people can't afford to eat well. After paying rent, people still have to pay for heat and hydro, transportation, clothing, childcare, home maintenance, medical bills, dental care, and school supplies.
It's terrifying. You become one of those kids who will almost do anything to stay at somebody else's house for food. And that's, it can be very unsettling. It's a very unstable feeling when you don't know as a child whether or not there's enough to eat. It makes December, January, and February harder because you can't just go to the freezer and pull out your store of tomatoes or peppers or onions even from your root cellar or what have you. Those months we'll probably tend to use the food banks. So we'll hit one in December, the other one in January, and then back to the first one in February until that sort of balances back out. But even that, you're still not getting the same nutritional value that I would have gotten from pulling things out of my freezer. Chances are it's canned goods. Chances are it's not fresh meat. Chances are the milk's been frozen or it's powdered. And chances are there's no fresh fruit or vegetable in that care package because they don't have it at that time either. So we'll get like a lot of red sauces, a lot of Kraft dinner, a lot of pastas, a lot of overly filling, not necessarily nutritious or nutrient dense foods, and that's sort of what we're packing up on in the winter.
All people in Elgin St. Thomas should have access to an adequate, safe, and nutritious diet. Each of us has a role to play. What are you going to do to make a difference?